And this first one says, can you please ask Dr. Esser whether having a high resting heart rate is considered a factor for heart disease?
Well, it's considered an increased risk over time for things like congestive heart disease, right, or congestive heart failure, right? If you're overworking the heart, because if your resting heart rate is already elevated, then likely your exercising heart rate will be elevated as well. So if you have a resting heart rate that is elevated chronically, you want to look at the factors like, are you dehydrated, right? That's the first thing to look at. Is it a medication or supplement side effect? Are you drinking excess amounts of caffeine or taking caffeinated supplements? Is your thyroid off, right? Some other hormonal imbalance, like a hyperthyroid state. These are important because we want to have a lower heart rate on average because it decreases the workload on the heart and can also be a sign of better autonomic balance. Remember, there are two automatic things going on in our bodies. There is the parasympathetic rest and digest, and there is the sympathetic fight or flight. These two portions of the sort of nervous system are constantly trying to find balance. If your resting heart rate is elevated, well, we want to know, is it a hormonal, right? Is it a, dehydration? Is it some other issue? Or is it just straight up an autonomic problem that you are chronically in a state of stress, fear, anxiety? So I want to address that, look into it, and determine what the cause is.
I just took mine while you were talking and it was about 54. Is that good?
I love it. Yeah. I mean, the average resting heart rate is 60 to 100 or so. We'd like to see it, right? The healthy and even well-conditioned individual below that 60 mark, if and when possible.
She says hers is high 80s to 90s. Her mom's is very hard, thyroid function normal. And she wanted to know if an exercise regimen like cardio would really help lower it that much, or do you have to be a professional cyclist to have a low resting heart rate? She is currently out of shape, BMI 28.
Yeah. So the first thing to say is, right, if you're over the age of 45 and a BMI of 28 and you've eaten the standard American diet, you want to get a good sort of screen before you start exercising aggressively. Mild exercise like gently walking, or even borderline moderate exercise like walking with a little light, kind of have to breathe a little bit, is okay. But if you're wanting to push yourself to actually achieve a better cardiovascular endurance level, I'd recommend that you get a workup first. So I'd have your lipids checked, I'd have your thyroid checked, I'd get an EKG, all the things that should be done according to the American College of Sports Medicine prior to really ramping up your exercise. But to answer your question, yes, if you exercise at a moderate level chronically, several days per week, you should expect that your average resting heart rate will go down.